Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. 888-630-9625. That's 888-630 WMAL. Love to talk to you on any subject you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've come up with the same old. Doesn't work, does it? Well, here's an opportunity. Let's talk about it, let's fix it, and let's do it without drugs and without surgery. And maybe we can do something different, like give you your life back. Wouldn't that be a great game changer for you? Well, that's how we do it. 888-630-9625. It's a beautiful day outside. I'm going to enjoy it after the program, and hopefully you will too if you're in your car. Make sure you listen today because I've got several things I want to talk to you about. And we're going to start out with asking you a question. Are your hormones gone? Are you too fat? Or is that body fat ratio off compared to what it used to be? Depressed? Your blood sugars are through the roof? You can't get your cholesterol down? What do all of those things have in common? Well, here's the deal. See, I've been complaining about a lot of different things around the house. I told Sue that, my weight's the same. Why is it that my belt size has changed over the years? My weight's the same. How come I don't have, the energetics that I used to have and so forth? And she just looked at me and she said, really? Really? And I said, okay, come on, here's the deal. So she dumps an article on me and she said, read this. I said, come on, I know this stuff. She said, yeah, well, you're looking in the mirror. Why don't you apply it yourself? What am I talking about? I'm talking about sleep deprivation, and I am like the worst offender that exists on the planet, and many of you are as well. And we end up with problems. We end up with hormones that are being depleted, both women and men, and they deplete differently because of different circumstances. We end up with this thickening, and not necessarily a belly that looks fat, but this thickening, kind of creeps up on you, and you look at the scale. In my case, I sit there and I thump my chest and I said, my weight is the same as it was 35 years ago, 40 years ago. And the truth of it is, but it doesn't look like it used to look. Why is that? Well, at that point, I was like 9% body fat, and today I'm probably somewhere in the neighborhood of about 15% body fat. And that's still within the margins, but is not who I am. A lot of you have put on weight slowly over time, and that weight deposits around your midsection and around your hips and that big black end of yours. It's just, we can look at the size of the girth and the width and so forth, and things aren't the same, but the weight is the same. How come that is? And then some of you have blood sugars that begin to rise, and your cholesterol levels go through the ceiling, and you're depressed. And all of that would make me depressed. I don't know about you, but nevertheless, depression, because of serotonin depletion, is another characteristic of that. So sleep deprivation is a problem. We're going to talk about that today because I need to take the lesson. So many times when I do these programs for you, I have to look at me in the mirror and say, well, man, that's hitting pretty close to home. I better start doing something about the thing that I'm talking about. Living in the Washington metropolitan area, we are on a rampage. We're growing constantly. We have to go from here to there, and we worry about finances constantly. Can we make one paycheck over the next? Our children are off the walls. And how do we deal? How do we cope? We're sitting, at home. We're arguing with our mate. We go to bed at night. We can't shut off our minds, so we're thinking. But getting too little sleep makes people crazy, but it makes them hungry. It makes them trigger all kinds of abnormal hormonal reactions. You may see it subtly with something that we call metabolic syndrome, where you start seeing blood sugars start creeping up. You may see your cholesterol start creeping up. You see your blood pressure start creeping up. All of those things have to do with sleep deprivation, as well as some other things, but that's one of the primary causes. abbreviated sleep seems to have very little effect on certain types of things, insulin production and blood sugar levels and so forth in the initial stages, but this is only in comparison to other things that they're measuring as well. But the bottom line is, over time, all of these things begin to get affected. So let's talk about that. You know, we go into our sleep patterns, and we think that, you know, we're getting enough sleep. We wake up in the morning and we go. Some of us are 5-hour sleepers. Some of us are 7-hour sleepers. Some of us are, you know, in between. We catnap. But what is good sleep? But let's talk about the effects first when you don't get enough sleep. And there's several studies that have been out there. But when you don't sleep, there's things that are called cortisol. You know, that stress hormone, that goes up. And when you don't get enough sleep, growth hormone decreases. When you don't get enough sleep, serotonin, the feel-good juice, goes down. When you don't get enough sleep, melatonin, the hormone regulator, and also allows your rhythm of adaptation at night when you're sleeping, goes down. The symptoms we talked about, increased blood sugar, your energy kind of is not there anymore. Your body begins to waste. It means that no matter how hard you hit the gym, and actually at that point it's counterproductive, you can't build muscle mass. Your body weight even sometimes will go down. It decreases, but the proportion that body weight is made of, muscle to fat, is out of balance. You have more fat than you should, and your muscle mass isn't proportionate. Wound healing, the ability to heal something, a scratch, is impaired. So guess what's happening inside? You can't recover as quickly. Your immune function, your ability to stand off and fight things, is impaired. Your psychological, emotional status is definitely impaired. You find yourself very reactive. You can't cope. You feel like you want to run away from things. That's probably, you know, the stress of the day. You just can't deal with it anymore. So some of you turn to having a drink every night. Some of you turn to just shutting down completely. Some of you, you know, turn to some illicit drugs, and some of them are prescription drugs that you become addicted to. All of those things can come a result of not sleeping well, and it's insidious. It's over a period of time. In the middle of my crazy professional life, I used to sleep, a good night was 6 hours. A bad night or a regular night was 4.5 to sometimes 5 hours. So over the years, that started chipping away at the armor. And the problem is that you don't see it happen until it happens. We've got to go into something called REM sleep, and that's rapid eye movement sleep. Why is that so important? Well, REM sleep is where you heal. That's the place where your brain begins to relax, your body metabolism begins to kick up, and the body sleeps. Rapid eye movement sleep is critical if you ever want to repair anything. The absence of deep, nourishing REM sleep allows all kinds of neurophysiological electrical changes within the brain, where short-term memory goes, your emotional reactivity is crazy, it's like a hair trigger, and the capacity to assimilate any kind of data information is something that is almost non-existent and gets progressively worse over a period of time. If we're constantly interrupted, if we're sleeping in a room that has any kind of ambient light, doesn't make any difference what it is, if we're not in bed at the same time all the time, if we don't develop the habits that we have to heal with, our bodies suffer the consequences of all this nonsense. So sleep patterns, we'll talk a little bit more about it and what you can do to make a difference. Take a look at yourself. You know, do you feel good? Is your energy good? Do you seem to need to have hormonal replacements? You know, guys and women today, unfortunately, you know, you hit a certain age, docs say, take this. That's not the way it's supposed to be. Is your blood sugar going up? And your docs say, well, let's watch it. Are you been put on statins just regardless? And by the way, they don't work. Remember that? So each piece has a why is that, and we're talking about one of the major problems in our area particularly, but across the board. We're a society that just is in stress overload. We're on our iPads. We're on our computers. We sleep with our phones. We have ambient lights coming off. We have night lights. Our rooms aren't black. Man was meant to sleep in a cave, totally blackness, so that pineal gland can regulate normally, and you end up in a much better place, bright-eyed, bushy-tailed, ready to get up and face the day the next morning. You know, there's been much controversy But it's becoming much more clear that REM sleep is involved in the learning process and cognitive pattern. Memory is critical. The brain has to be plastic. We call it a plasticity. It has to be able to adapt and be able to handle constant input of information. But without sleep, we can't do that. And if we don't go into REM patterns, it's almost totally impossible. 888-630-9625, 888-630-WMAL. Love to talk to you. I'm talking about sleep. We're also going to talk about the heart in a little while and all those things that can make a difference. But in this particular situation, I'm encouraging you. It's my fault as much as many of you. I'm kind of catching up on that now. I'm making a difference. I'm sleeping. I'm forcing myself not to do that last little thing at nighttime. I'm structuring my time a little bit better. But I paid the price over a period of many years. I'm the one that, unfortunately, pushed and pushed and pushed and pushed because everything was more important than my getting to bed on time. Everything was more important. So, oh, my gosh, I have to do this. Oh, my gosh, I have to do this. Can you imagine now what it's like in the advent of the computer and what I do when I get home? I mean, I put in these ridiculous days, and then I get back, and I sit at the computer at nighttime, and Sue's yelling at me to get off the phone or get off the computer. It's ridiculous. We're constantly texting. Everything is instantaneous. Our brains are being overworked. Sleep, my friends, is critical. And if you don't have a complete sleep pattern, if you don't really put it together on a regular basis, consistently, as a habit, we're all headed for trouble. Take it for somebody. It's like an ex-smoker, right? I'm becoming evangelical today. I'm trying to tell you what you should be doing, even though that I did it the wrong way for a lot of years. But it's reversible, and that's the message that I want to get out to you, is you can fix a lot of things. Many authors will say that, once you destroy the brain, you destroy the brain. Well, there is a circadian rhythm in humans that can be reset, and even though that cells of the brain are known not to be able to be repaired once they're totally destroyed, there are many other cells that can take over for other cells that are depleted. The brain is very holographic. And what that means is that every other piece of the brain has the memory of every other piece of the brain. So when we know that, there are ways like brain mapping and so forth that can reestablish normal sequential patterns in the brain and bring it all back. Trust me, after a couple blows to my brain and the sleep deprivation and all the things I've done to myself over the years physically, I suffered some consequences of what we're talking about, and it is reversible. It's something that you can put back together. That's the good news. That's the important piece. You can resolve this thing. And what it takes, though, is a commitment on your part. It takes you to decide, okay, it's time. And even a nap in the afternoon, you can, if you have the capacity in your office in the day, just to go take 10 minutes and just sit quietly, close your eyes, put your feet up, don't let anything disturb you. But what I mean, no input around you, no television, no screens, no telephones, nothing. Go to sleep. And then wake up. You'll find that just doing that sometimes will help the repair process. A couple of weeks ago, that was probably a month or so ago now, I was totally wiped out. And what took place was I walked in and I was zombie-like, and one of my staff members told me, you are going to sleep when you're done with your morning patients. And I said, I can't have, you're going to sleep. So anyway, they forced me. I went into the massage therapy room and I laid down, and I was out for 20 minutes. But when I got back and I was ready to work, my head was clear. We're going to teach you how to do that. We're going to put together a few processes as the program goes on, because what I'm going to tie in later on in the program is heart problems and the things that you should be supporting the heart with and the foods that you need to support the brain with, so things can heal, so your nervous system can act properly. If we do those things, life can be a whole lot better. Things like B12 and folate and vitamin B6 and vitamin C and E and NAC and so forth, and the list goes on. But which ones are critical for you, and how much of that do you have to buy, or can you get it actually from your food? Well, the bottom line is you can get it from your food, which is the critical piece. Our phone lines are lighting up, and I will take the calls. We're coming up to a break. We're going to have to stop for some very important information, the people who sponsor Dr. Roselle live here at WMAL, so don't go away. I'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. We have several people on the line, and I want to, before we get into the other information that I have sitting up here waiting for you, I'd like to answer your questions. Martha, thank you for calling. How can I help you?
Yes, good morning, Dr. Roselle. I heard on Dr. Oz's show the other day talk about the digestive system, and particularly the immune system being in the digestive system, 70%.
Actually, more than that. Some authors will take it up to about 85%, but we're talking about a little difference there. Go ahead.
Okay. And he talked about enzymes, and he said that when your enzymes are low, you develop, allergies like lactose intolerance and things like that. What is your take on that?
Well, when your enzymes are low, your body can't defend itself from bacteria, but it also can't break the food down. Digestion starts in the mouth, and if you don't chew your food well, then you can't mix your food with something called parotid or salivary enzyme. That triggers the stomach to produce acid, hydrochloric acid. If you don't have enough hydrochloric acid, you can't break down proteins. You can't get the body to start the process of stimulating other types of activity once it goes into the small intestine. So pancreatic enzymes have to be stimulated by the acidity from the intestine. You have something called pepsin also in the gut. So hydrochloric acid and pepsin then combine with the food in the stomach. Then it goes into the intestinal tract, and then it stimulates the pancreas and the gallbladder to dump their enzymes. Now, if you're putting food in there that hasn't been worked on properly, then the intestinal tract becomes irritated, it becomes inflamed, it becomes cracked. And what happens is something called a permeable intestinal tract. That means that the intestinal system now is almost like a colander with very, very fine mesh. And it allows things to absorb into the system, not fully digested, so the body becomes more allergic, and you end up with things like a lactose intolerance, with the bloating and the cramping, the gas, and so forth, and it can be very painful. The same thing with, we're seeing so many more people today gluten sensitive, and gluten allergies and gluten toxicity, which, by the way, are two different things, are there because there's not enough enzyme action within the intestinal tract to break it down, but also thanks to Monsanto, they're GMO, which means that these genetically modified organisms have 10 times as much gluten as anything else. So Dr. Oz, I didn't hear the program, so I can't comment specifically, but he's right in saying that if you don't have enough enzymatic action, you're going to be much more sensitive to things. That's absolutely correct. And how can you put enzymes in your system? Well, your body should work and produce them at any age. So what happens over time is because of the things that we eat we shouldn't be eating, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, that's the mainstay of so many of our diets, that we become more immune sensitive. And because your first part of your immune system is the mucus secretions in the intestinal lining from your mouth all the way down to your rectum, and that's called IgA antibody. If those things are low because of the stress patterns within the body, then we can't produce it. So it's not a simple thing as, well, if I don't have any enzymes now, what do? You can get enzymes. You can get hydrochloric acid precursors. They're called betaine hydrochloride. You can get pancreatic enzymes. You can get full spectrum enzymes. If the bacteria in your gut gut's not working the way it's supposed to, you can do a probiotic. Or if you do the enzymes then you, and the probiotic, you can add a prebiotic. What that means are those are the things that will help you build your own acidophilus, your own good bacterium. So if those things are gone, you're not going to do that. So it's more than just take this for this. You have to understand the process. If the nervous system, if the nerves from the brain, the cranial nerves, particularly the vagus nerve isn't working, or the nerves from the spine, we call them the parasympathetic nerves, that go to these organ systems that trigger these things are irritated, then you're not going to produce them, or you're going to produce them at way too high levels. So there's a multiplicity. But we see this type of presentation in our practice all the time, and each individual has to be taken in its own lights, based on blood typing, your heritage, your constitutional type, the levels of enzymes that you have, what needs to be added, can they be stimulated properly? Now that I've totally confused you, I hope that helps you a little bit.
No, I'm not confused. But thank you very much.
You're welcome, Martha. Thank you for your call. I really appreciate it. 888-630-9625. Greg, how can I help you?
Hello, doctor. How are you?
Good, sir. How are you?
Yes. I'd like to know what can the medical profession do to help senior citizens who are suffering, especially in Maryland. I have relatives in nursing facilities in Florida with these very loud boom cars. It's a fad now with young men driving around with these super loud earthquake sound automobiles shaking people's houses.
Greg, that has to go to legislation and community laws and so forth. There's nothing the medical profession can do except, and with the exception of what they've done, there's a lot of information that's available. If you just go on Google and put the effect of loud noises on health, effect of loud noises on immune system, effect of loud noises on brain patterns, there are hundreds and hundreds of articles that have been written over the decades. But the bottom line is that your local legislative councils don't want to take action on these things or enforce them unless they become obnoxious. If a kid's out there or a group of guys and they've got their cars all jacked up and the bass on the car is so high that you can feel it just sitting next to them at the light, obviously if the police officer's not there, there's nothing they can do. But if so my comment would simply be this: get as much data as you can, and then go to your local councils and state legislatures and see if you can get a law and put some push into it. Got to take a break. We're coming up for the news. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. Yes, I am. I'm in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We've been talking about sleep problems because, I look in the mirror and that's me. I don't get enough of it. But the bottom line is you got to sleep, and you have to sleep at the same time. You have to sleep with the lights out. You have to sleep in a cool room. And don't try to drug yourself into somnambulance. It doesn't work. And your brain begins to even go down the tubes even that much faster. All these ads out there for your good night's sleep, take whatever. Well, it doesn't work that way. You need to find out what the reason is. Sometimes it's hormone depletion. Sometimes it's an intestinal tract problem. Sometimes it's injury to the structural system, the spinal system of the body, the cranial plates, those bones that hold your brain that we said that move in and out and flex and extend when you breathe. Those are the problems. Just don't take melatonin for the sake of taking melatonin because you want something naturally. Sometimes you've got to produce serotonin, and you can do things like tryptophan and vitamin B6. Tryptophan is produced again. Thank you very much. I appreciate the government lifting the ban on that because we use it in the practice on a regular basis. You can use that about an hour or so before you go to bed. Taking something like phosphatidylserine is also very, very productive in getting you to sleep. But more importantly, get all the lights out. If you have any digital printouts, put something over the top of it. Make sure the room is cool. Go to bed the same time every night. Don't sit up and watch the talking heads and put your butt in front of the computer, so you're jacked up and you can't calm your brain down. Go for a walk on a regular basis. Get your body to start dumping this thing. Drink a lot of water. There's that water thing again, because you want to get rid of the toxins in the system. However, sleep patterns have a why is that, and you have to be instrumental in trying to get your body to do what it needs to do. And by the way, those of you who think that you don't have enough time, if you're not getting enough sleep, you will have less time because you will be less productive and less efficient and less detailed. You've got to go to sleep at night and get yourself a good night's sleep. If you're in really good shape and your body feels good and you're eating well, getting rid of all the junk in your body, and your room is dark, you can probably get away with 6.5 hours sleep most of the time, maybe with a 5-minute cat nap, but most of us can't do that. You need more than that. Vitamin D will also help, believe it or not, regulate the sleep cycle. Yes, indeed, we're back to our friend vitamin D, and we're going to talk a little bit about heart today, and we're going to mention vitamin D again, but nevertheless, 888-630-9625. Colette, how can I help you? Thank you for calling. Colette? Hello, Colette? Are you still with me? We can't find Colette. She wanted to talk to me about chest pains. Colette, try calling back again. See if we can get you back on the line. But right now, you're not there. I don't know why we can't pick you up, but we can't. So we'll go on. Heart disease. Let's talk a little bit about that and why we have so many problems fixing it. Well, the bottom line is that the information is being diluted, and it's being manipulated, and it's not being fairly played out the way it should. Why is that? Because it comes back down to Fifth Avenue marketing. You are being told only those pieces that the talking heads want you to assimilate, because it's big business. It's very, very big business. We've told you over a period of time that, for the most part, statins don't work. And why is that? Well, because it's not about cholesterol. It's not about the amount of cholesterol floating around in your bloodstream. It's about the stickiness of the cholesterol to the arterial walls. And they don't talk to you about the cracking and the fissuring in the walls that the cholesterol tries to protect, and the body begins to produce more of it to try to help the irritation. There's this thing called fibrinogen, and that's scar tissue. Your doctor doesn't order that to find out why the low levels of fat that you have are sticking to the walls. Fibrinogen is one of the causes. Your doctor doesn't talk to you about the inflammatory levels that come from pain, that come from not sleeping, that come from your eating things that set up inflammation. What? Sugar, sodas, coffee, here we go again, right? The old mantra. Cardiovascular disease is big marketing. There was a gentleman, 84 years old, and last name by the name of Kramer, and this goes back, maybe 15 years ago or so, and he was interviewed because here's a guy who has a family history of all kinds of problems. He had a father that died at age 54, and other people that died, at other young ages in his family. But he's 84 years old and still hanging out and working out in the gym 5 days a week and taking absolutely no medications whatsoever. And obviously it got people's attention based on history and genetics and so forth. He should have been checked out, right? Well, it wasn't so. And there are other things that they ultimately found that they had to take into consideration. But do you think this stuff would ever hit the press? Well, 8 years, this man, David Kramer, was following Linus Pauling's protocol using high dosages of vitamin C, lysine, and something called proline. And the results of the program that were his levels of something called lipoprotein A and triglycerides decreased dramatically just doing that. Now, what are these things and why do they work the way they work? Well, his story was kind of interesting. His lipoprotein A's, were significant at one point. He had high levels of apolipoprotein A, very destructive. He had high levels of lipid peroxidases, not a good thing to have around. He had high levels of oxidized LDL particles. These are the bad guys that go in your blood. That fibrinogen thing that we just talked about, that was up through the roof. He had low levels of the protective forms, the good guys. He had low levels of vitamin C in his blood. He had low levels of something called lycopene. Those are the things that you get from tomatoes. And he had low levels of something called gamma-tocopherols, which is a vitamin E form. So when you look at this guy, he's like a heart attack waiting to happen. And he should. And then understanding that his family, we talked about his father, his mother died of a ruptured artery in her chest, the aorta. Father died young at 54, and he had brothers that died, one at 54. And here's this guy, that is kind of, ready to have his own problem, and he beats it. So how did he beat it? Well, as you look into the story, he began to do his own research, and he found out that there were other ways of handling this stuff. And he began to do his research and then put together Pauline's work and put together some other docs' work and so forth, and started using high dosages of vitamin C, lysine, and proline, and enabled him, after actually having had some problems, to begin to function at a very, very high level. Why is that? Why are things so easy? Why, if you eliminate dietary irritations, why is it that if you begin to support the system with good stuff, that you can beat all the odds and beat everything that they're telling you that you have a problem with? See, the bottom line is that you got to do something different when you know you have a problem potentially, because if you do the stuff that they want you to do, it doesn't matter. You still die. As I keep quoting the New England Journal of Medicine study, that you have to treat 100 men for 5 years with a statin to prevent one heart attack. So if that's true, if that is true, then why are we being duped? Again, it comes down to somebody's got to make the mortgage payment next month. And it's huge business. We're talking about billions and billions of dollars relative to cardiac disease and cardiac surgeries and the support systems that are behind the drug companies and so forth. Colette, are you back on the line?
I am.
Hi.
Hi. I have this week, starting last Sunday, chest pains every time I eat or I drink something. It's that I wasn't able to swallow. It was having a hard time breathing. And I went to the doctor. The doctor took EKG. So she said that it is not, doesn't look, it's irregular. So she sent me to the ER. After they did their own EKG, they said that there's no heart, it's the esophagus, something in the esophagus. They gave me this Cardiovascular suspension. Then I went back to the doctor. The doctor, she wasn't satisfied. She sent me to the cardiologist.
Okay, Colette, I'm gonna stop you right now, only because of the fact that the problem that you have is very simple. And it's a prime example of traditional medicine looking at symptoms and not looking at the cause. Just with what you told me, it's difficult to swallow, chest pain.
Yeah.
Before anything else, you look at the diaphragm. The diaphragm is the muscle that cuts you in half, the upper part of the body from the lower part of the body. Above the diaphragm, you have the heart, you have the lungs, and when you breathe in, the diaphragm moves down to let the lungs expand. When you breathe out, the diaphragm moves up. And this pumping mechanism allows you to get oxygen into all the tissues and to breathe more deeply and so forth. When the diaphragm, like any muscle, doesn't work properly, when it gets stuck, if you will, to use that terminology, or where it goes into spasm, then one of these symptoms, they call it the great mimic, because it can cause chest-like pains. It can cause angina. Years ago they used to say, well, you have angina, and you'd go in, the heart was fine, but you have angina. Take nitroglycerin for your angina. It has to do with, in most cases, it has to do with the diaphragm not moving properly. Now, the diaphragm, like a muscle, has nutritional needs. It also has nerves that go to it. It also has an acupuncture circuit that goes to it. Now, through the diaphragm also has to pass the food tube called the esophagus. It has to have a hole for the aorta that comes from the heart to the rest of the body, and then it has another hole for the vena cava that goes from the lower body to the rest of the body. So when this diaphragm gets stuck, it's going to have an effect on the nerves. There's a nerve called the phrenic nerve that comes from your neck, the vagus nerve that comes from your brain, and then the nerves called the splanchnic nerves that come from your back. So you have this big feedback mechanism. That's where your pain is coming from. And hopefully they didn't put you on any medication. Hopefully,
I did not take the medication yet, because I'm always weary about these. Besides, a month ago, she said after she did some blood tests that I have Lyme disease, and she put me on antibiotic. So the antibiotic is about to finish now. Well, I was wondering whether that caused something.
Yeah, the diaphragm will relax over time, particularly if you drink if you have something like that, you have chest pain, get something warm to drink, like a cup of hot water with a little lemon in it, and just sip on it. The other thing, if you have any bone meal contains an active enzyme called phosphatase that will relax the muscle of the diaphragm. You just get a couple of bone meal tablets and chew it up. That will help as well.
What would you repeat? Would you say that?
Bone meal. B-O-N-E. Bone meal.
Bone meal?
Bone meal. M-E-A-L. You can get it at a health food store. That will help. But if it's the nervous system, you need to go see a chiropractor, somebody that does the work that I do, and you can fix these things so they never come back. Magnesium also will help relax the muscles. Sometimes the body's not taking in calcium the way it should. It's bringing in too much so the muscle stays too tight, and the magnesium will also relax it. But all of those things can make a difference.
How much magnesium I need to take?
I would take 1 milligram of magnesium actually in this situation, I would take 2 to 3 milligrams for every pound of body weight. And that should help. But take a magnesium glycinate form, Glycinate. It won't hurt you. The only side effect for that little amount of magnesium is you might get a little bit of a loose intestinal tract. But I doubt it. At that level, it's probably not going to affect you at all. Colette, I appreciate your phone call. Thank you. Shirley, real quick, how can I help you?
Yes, delighted to hear you. Happy New Year.
Happy New Year to you.
I have a lot of chronic conditions, but you really have my problem today, which is sleep. I only get about 3 or 4 hours a night, and I wake up every night between 3 and 3:30. And this has been going on for years, and I'm at my breaking point.
Shirley, between 3 and 5 o'clock in the morning has the energy for the lung in traditional Chinese medicine. So if it's constant, if it's between that time of night all the time, then there's the energetics, the energy in acupuncture to the lungs is unbalanced. It's not doing what it's supposed to be doing. That's typical pretty much for if you told me that I wake up all the time at midnight to 1 o'clock in the morning, then we start looking at your liver. If you told me that you were waking up later on in the morning, it could be the large intestine or the small intestine or the heart. So based on those areas, we'd have to look at that. I want to cover that just a little bit more, Shirley. Don't go away. I've got to take a break for some very important messages coming up, but I want to pursue that just a tad more.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live, reminding all women to conduct monthly and annual breast exams. Also consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, call 888-485-7736 or visit thermographycenters.com.
This is Dr. Tom Roselle Live on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio today, 888-630-WMAL. We broadcast from this spot every Sunday at 12 noon. We're here to give you the best information possible and to tweak your interests, so to speak, to give you the motivation to go do your own research, because health is a do-it-yourself program. You must be in command, particularly in today's world and today's marketplace. If you're not, nobody else is. And just remember, my belief system is as long as you're breathing, you can change something. So begin to change your life with a decision that you want something better than where you are right now. Let's go back to the phone. Shirley, are you still there? Shirley?
Yes.
Hi. Listen, I want to get back to talk to you just for about a second or two. The reason that I jumped in and I said to you that if you wake up at the same time all the time, it has to do with your lung, is in the acupuncture system, the energy areas that are specific for different organ systems have their highest energies at certain times of the day. The lung is between 3 and 5 o'clock in the morning. And so as you go into sleep, you get to sleep about, an hour or 4 hours before. As you get close to that lung energy, then anything that's associated with the lung is going to be higher. And your sleep pattern will be disturbed at that point. Now, my question to you is, are you able to go back to sleep later, or are you awake?
No, and I can be sleepy, about ready to collapse, and when I lay down, I can't pull the sleep up.
What time do you normally go to bed?
Between 9:30 and 10.
Okay. Were you ever a smoker?
No.
Okay. Were you exposed to smoke? Somebody in your family?
Yes.
Okay. Do they still smoke?
No.
All right.
That's been years ago, maybe about 40.
Okay. Have you ever had any problems with pneumonia or asthma or anything like that?
No.
Okay. Anybody in your family die, with years ago, or even 5-10 years ago, that you've never totally gotten over their death?
Oh, my Lord, yes.
Okay. So, see, every organ system has an emotion, and the emotion that's associated with the lung is unresolved grief. So if that's not taken care of, if you don't resolve that, then the lung is always going to be susceptible, and the energetics to the lung are always going to be unbalanced. Now, that can be treated, and that can be handled properly with acupuncture and herbs and so forth. The practitioner doesn't need to know what the situation is. But anybody that suffers from unresolved grief patterns, never truly completing the cycle on it, is always going to have a susceptibility, a predisposition, if you will, to the lungs. So if I can help you, Shirley, give me a call. I'll be more than happy to talk to you offline, as well as get a hold of me at rosellecare.com. Send me a note, and we'll go back and forth. If we can help you, please make an appointment. 888-630-9625. We have several people hanging there, and I'm awfully sorry I'm not going to be able to get you today. But if you'd like to talk to me when I'm not in the studio, you can do that. Send me a note. It's the easiest way. I always answer my email. Go to rosellecare.com. That's ROSELLECARE.com, and I will get back to you. If you'd like to see one of my practitioners, real simple. You can go online and go to rosellecare.com or 703-698-7117. We do seminars in our office, as many of you know, our in-house continuing education program, but what you don't know is that we do seminars outside the office. So if you have an organization, if you have a group, if you have a community that you would like us to lecture to, we will set that up for you as one of our tributes to the community. Just give us a call. Call Dareth. 703-698-7117. Coming to end of another way too short program. We'll be here next Sunday at 12 noon, as always, bringing you the best information possible in integrative care. This is Dr. Tom Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.